Hey everyone, today we're going to talk about who should get genetic testing. My name is Dena Goldberg, I'm a board certified genetic counselor, and let's dive into this. Who could benefit from genetic counseling and genetic testing? If you ask me, everybody at some point in their life could benefit. Whether that's preconceptional, so before you have a baby, when you're pregnant, when you have a child that has an undiagnosed condition or an adult with an undiagnosed condition. And then if you have a family history of something like cancer or heart disease or a neurological condition and you're worried about your risk for it. And even beyond that, people who are healthy and just want to know about their risks for conditions or diseases going forward and how to lower their risks. And then those who are maybe adopted or donor conceived and don't have any family history information and want to use all the tools at their disposal to really understand their future health risks. So all of these people could benefit from genetic counseling and genetic testing. If we think about the way that our guidelines are written in the United States, typically it depends on somebody's personal and family history. If we believe that they have a high enough risk that they have a genetic change that would put them at an increased risk for a condition, then we will offer genetic testing to them. If somebody has a strong family history of a condition that is in multiple relatives, if it's at a young age, or if it's a condition that we know is more commonly associated with a hereditary genetic change, or a change that gets passed from parent to child, then they may qualify for genetic testing based on that. Ideally, they'll get referred to a genetics clinic through their healthcare provider. And then in the genetics clinic, whether it's a cancer clinic, a prenatal clinic, a pediatric clinic, cardiology or neurology clinic, those genetics clinics will do a very thorough evaluation to understand if a person would benefit from genetic testing for that specific indication. And we really want to do an indication-based test because there are so many different ways to look at our genes. There's no one size fits all test or one test tests all, contrary to popular belief. So we really want to know what we're testing for. And the only way to do that is to really take a very thorough evaluation and then also talk to the patient and understand what their motivations are for testing. So one of the things I do is I often ask people, what are you hoping to learn from genetic testing? And then we talk about what it can and can't tell somebody, because there's a lot that it cannot tell us, but there is also a lot that it can. Just understanding the benefits and limitations to genetic testing is very important before you do a genetic test. Now, that said, I personally have a clinic where I work with a lot of people who are just interested in proactive testing. Either they're adopted, they're donor conceived, they don't have family history information for whatever reason, and so they can't really qualify for genetic testing in the traditional healthcare system. And so we'll talk about what their options are for testing there. Or it's people who come in for a proactive test, but once we go through their personal and family history, they actually qualify for testing based on that history. Maybe they had more cancer than they thought, or there's people with heart disease at a very young age. There's a lot of reasons why somebody would be suspicious for having a genetic condition. Now, there are also people who will come in and they don't truly know their history. And for those, it's going to be a different test that we offer them. We typically only test children for childhood-onset conditions where it will immediately affect their medical care plan. Maybe there's an intervention to take very soon, or they may develop symptoms and we can get ahead of the symptoms if we know early. So those are the childhood onset conditions. And at this time, they're typically referred once there's already some sort of sign or symptom that something might be off, or they were caught on newborn screening. And I think as a field, we all kind of agree that a child onset condition can be tested in childhood if there are interventions to take. Then there are adult onset conditions, and these are conditions where the manifestation of disease or the issue that someone's at risk for don't really come until adulthood. And we find that it's better for a person to make a decision about their own genetic testing once they're an adult and can give informed consent, can make that decision. And so for adult onset conditions, we typically don't test people until they're at least 18 and they can make their own decision. Now, that being said, there are exceptions, and it really is a case-by-case basis for these exceptions. And oftentimes it will involve a team kind of talking this out and talking it out with the patient and making sure that that decision is truly in the best interest of the child, and it's not just a parent who's having anxiety and they may not understand some of the negative outcomes of testing minors. We do prefer to test people once they can make their own decision. And of course, there are exceptions to this, but they're truly a case-by-case basis. But in general, the adult onset conditions we test in adulthood. It can be really difficult to learn some of this information, which is why it is so helpful to speak to somebody that truly understands both the genetic testing, the science behind the test, but also the psychosocial implications or the emotional outcomes of the test and what that could mean for the person sitting in front of us, which is precisely what we are trained in doing as genetic counselors. And in addition to that, we're not just testing the person in front of us. We're also giving them information that could affect family members, which is different in other areas of medicine and healthcare. And so we have to think even more carefully about the way that we talk about some of these conditions with our patients, because it can affect their family members as well. And we also can help them communicate risk with family members. Anyway, working with a genetic counselor, really great. Definitely a plus, and can be really beneficial in making these decisions. If you are wondering if you fit criteria for genetic testing, I would recommend talking to your doctor about it and asking for a referral to a genetic counselor, or looking up some of the content that I have about guidelines for genetic testing. And if you fit guidelines, then you should be able to access genetic counseling and genetic testing. I'll put more resources in the caption about how to find a genetic counselor near you. If that was helpful, make sure to subscribe and follow along for more on genetic counseling and genetic testing and how it can help you.